Black seed oil can be effective for anxiety, depression, epilepsy, learning and memory, sleep problems, neurodegenerative disease, and it's also an anti-tumor agent. Black seed oil, or Nigella sativa, or black cumin, is an annual herb and a spice belonging to the buttercup family. Black seed oil is native to the Middle East, Southern Europe and North Africa, and it's been used for millennia for a variety of illnesses. Its main active compound, thymoquinone, has been shown to benefit cognitive and mental illness, cardiovascular disorders, cancer, diabetes, inflammation, and infertility. And black seed oil has been used for a variety of bacterial, fungal, parasitic, and viral infections. It's shown promising results in early studies to be effective against HIV and AIDS. Black seed oil is an acetylcholine esterase inhibitor. It reduces tumor necrosis factor alpha, and it increases brain-derived neurotrophic factor. Supplementing with black seed oil seems to modulate neuronal signaling pathways in the brain, affecting synaptic plasticity and long-term potentiation, which can help learning and memory. The compound thymohydroquinone in the black seed oil is one of the most potent acetylcholinesterase inhibitors on the planet. By increasing acetylcholine, the acetylcholinesterase inhibitors have been found to be helpful in treating apathy, autism, dementia, Alzheimer's, schizophrenia, and Parkinson's disease. Black seed oil increases L-tryptophan and serotonin levels in the brain. This provides an antidepressant effect following repeated doses. Black seed oil has been shown in animal and human studies to support neurogenesis and long-term potentiation, showing positive effects on learning and memory, particularly working memory. Black seed oil is extracted from Nigella sativa, a plant belonging to the buttercup family. It's been used as a remedy for colds, fevers, headache, toothache, skin diseases, wounds, fungus, parasites, warts, and insect bites. Most of the nootropic benefit from the black seed oil is attributed to thymoquinone. Animal studies show black seed oil is effective for boosting memory in aged rats, and these findings were also demonstrated in human experiments. One study by the University of Dhaka in Bangladesh recruited 40 elderly volunteers and divided them randomly into groups A and B. Group A were given 500 milligrams of black seed oil twice a day for 9 weeks. Group B received a placebo. Neurological measures for the trial included a logical memory test, a digit span test, array Ostrich complex figure test, a letter cancellation test, trail making test, and a Stroop test. The Ray Ostrich complex figure test is particularly interesting. People are asked to produce a complicated line drawing, first by copying it freehand and then drawing it from memory. The test permits the evaluation of things like visuospatial abilities, memory, attention, planning, working memory, and executive function. The study concluded black seed oil supplementation for 9 weeks demonstrated a significant role in enhancing attention, cognition, and memory. Another study with 48 young men aged 14 to 17 who used 500 milligrams of black seed oil per day for 4 weeks had better short and long-term memory and better recall. Black seed oil is known to have anti-convulsive effects in traditional medicine, and because many epileptic children don't respond to modern anti-seizure medication, researchers have been conducting studies to find out if the black seed oil could fill this purpose. In one study in Iran, it worked with 22 patients who were divided into 2 groups. In this double-blind crossover study, thymoquinone was compared to standard anti-epileptic drugs over a period of 4 weeks. The study concluded that thymoquinone, the main active compound found in the black seed oil, has anti-epileptic effects in children with refractory seizures. Other studies have not been as promising. One study worked with 30 intractable epileptic children and 5 healthy children's controls. Here again, black seed oil was compared to the anti-epileptic drug over a 4-week trial. Researchers in this study found 40 to 80 milligrams per kg per day of black seed oil as an add-on therapy did not alter the seizure frequency or the severity in intractable epileptic patients. Another study with 20 epileptic children aged 13 years used an aqueous extract of the black seed oil, 40 milligrams per kg, 3 times per day for 4 weeks. In this study, seizure frequency was reduced significantly during the treatment. The takeaway here is when using black seed oil for hoping to reduce the number and the frequency of seizures, it may or may not work, but the higher dose would be recommended. Many cognitive ailments that we suffer from today are nothing new. Our ancestors thousands of years ago were dealing with many of the same issues. As we get older, our brain chemistry and our energy metabolism changes. This can happen at any age once we enter our adult years. Chronic inflammation can increase. Cardiovascular disease like high blood pressure, atherosclerosis. Metabolic disease like diabetes and non-alcoholic liver disease. Neurodegenerative disease like anxiety, depression, Alzheimer's and Parkinson's, and even bacterial, fungal, parasitic and viral infections can all increase. Avicenna, the famous 10th century physician, in his book The Canon of Medicine, recommended black seed oil for enhancement of the body's energy and support during recovery from fatigue and dispiritedness. Thymoquinone is the primary active component of the volatile oils in the black seed, and most of its effects and actions are related to this. The black seed oil is anti-tumor, antimicrobial, antihistamine. It modulates your immune system, it's an anti-inflammatory, and it acts as an antioxidant. In the traditional system of medicine, practiced in the Arabian Gulf region, black seed is recommended for fever, cough, bronchitis, asthma, chronic headache, migraine, dizziness, chest congestion, obesity, diabetes, paralysis, back pain, infection, inflammation, rheumatism, hypertension, and gastro issues like dyspepsia, flatulence, dysentery, and diarrhea. Over 150 clinical studies over the last 50 years have investigated the chemical and the health benefits of the black seed oil. These studies justify the broad and traditional therapeutic value. For the brain, studies have shown the black seed oil helps with Alzheimer's, Parkinson's, depression, brain inflammation, epilepsy, reduced blood flow, glial tumours, and traumatic brain injury. Users report using black seed oil daily makes them feel better and they have more energy. Several people say using black seed oil helps relieve their migraine symptoms. A couple of people commented the black seed oil gave them vivid dreams. Some say it helps to keep their allergies under control. Black seed oil is said to reduce inflammation and to balance hormones. Others say they get powerful relief from pain. One person reported she lost 11 pounds. Her joints weren't aching. There was no more constipation and her sleep had improved tremendously. And she was only 1/4 of the way through her bottle. Another long-term user of black seed oil said he hasn't been sick in over 2 years. And several neurohackers say that black seed oil helps them to quickly fall asleep. 40 elderly volunteers were recruited by researchers at the University of Dhaka, Bangladesh. The study was conducted to see if memory improvements from the black seed with animals also worked in humans. Half of the group were given 500 milligrams of black seed oil capsule twice a day for 9 weeks. The other half received a placebo. The university research team found a significant improvement in memory, attention, and cognition in the group using the black seed, with no significant improvement in the placebo group. The researchers concluded the black seed oil should be considered as a supplement for enhancing memory, attention, and cognition. A study with 48 healthy male volunteers, aged 14 to 17 years, were recruited and split into 2 groups. Group A received 500 milligrams black seed oil capsule once a day for 4 weeks, and Group B received a placebo. The volunteers were assessed for cognition using verbal learning tests, mood and anxiety. Tests were done at the beginning of the trial and after 4 weeks of supplementation. The research team concluded after 4 weeks of using black seed oil, there was a significant mood improvement, a decrease in anxiety, and a boost in cognition. Several different drug and drug combinations are prescribed to reduce seizures in epileptic children, but nearly 15% of children are resistant to the treatment. Black seed oil is known to have anticonvulsant effects, which are mainly attributed to the thymoquinone. A double-blind crossover clinical study was conducted in Iran with epileptic children. 22 patients were divided into 2 groups, with one group receiving thymoquinone and the other a placebo for 4 weeks. They each had 1 week washout period, and then the groups were switched and dosed for the other 4 weeks. The parents were happy with the results of the trial because the children had significantly fewer seizures when using the thymoquinone. The researchers concluded the thymoquinone has some anti-epileptic effects in children with refractory seizures. Opioid addiction is a major problem in society. The most successful treatment so far for quitting tends to be a 12-step program, but success rates in recovery and those ending up in relapse demonstrates how difficult it is to get off these drugs. A new novel treatment for dealing with opiate withdrawals may help. A study was conducted in Karakai to find a non-opiate treatment for opiate withdrawals, and it had 35 addicts recruited for the clinical trial. The study found 500 milligrams of black seed oil significantly reduced the opiate withdrawal symptoms. The recommended dose of black seed oil is 1 to 3 teaspoons per day. If you've never used black seed oil before, start with a half a teaspoon to see how your body reacts. Children under 11 should only use half the adult dose, and kids under 5 only a drop or 2 to start with. Black seed oil is considered non-toxic and safe when used at the recommended doses, and like most supplements, more is not better. Higher doses can lead to indigestion. You should not use black seed oil if you're pregnant or breastfeeding. It's always best to check with a doctor before using black seed oil, especially if you're dealing with a chronic health condition or you're currently taking medication. Don't use black seed oil if you have a bleeding disorder or you plan on having surgery. If you have low blood pressure, black seed oil could make the condition worse. And too much black seed oil could cause liver or kidney damage. On the skin, black seed oil can cause a rash or hives, so it's always best to do a small patch test before to see if you have an allergy. Black seed oil is especially helpful for people dealing with stress and anxiety because it affects the GABA pathway in the brain, which provides an anxiolytic effect. Recent research shows depression may be caused by inflammation, and black seed oil can reduce the symptoms of depression because it decreases levels of inflammatory markers like interleukin-4, interleukin-6, interleukin-13, and tumor necrosis factor alpha. The black seed oil can increase learning and memory within 20 weeks of consistent daily dosing. If you've tried other medication to reduce seizures with no luck, you could try black seed oil because it's been shown to be effective with some types of epilepsy. And 20 years of research shows black seed oil can be effective in suppressing tumor development, growth and metastases for a wide range of brain tumors, including glial tumors, which can't be treated by modern medicine. For more information about herbs, supplements and natural treatments, check out my website.